My name is Robin Lennox. I'm the MPP for Hamilton Centre, and I'm here today with my colleagues and advocates to mark International Overdose Awareness Day. I am joined by Alexa Gilmour, the MPP for Parkdale High Park, by Kristyn Wong-Tam, the MPP for Toronto Centre, by Diana Chan-Mcnally, a community worker and advocate here in Toronto, and by Hannah Robinson, a parent impacted by the overdose crisis. Today, we gather to mark the upcoming International Overdose Awareness Day with a call to action for our provincial government. The overdose crisis was declared a public health emergency 9 years ago, but the Ford government still doesn't have a strategy to confront the crisis that we're in. We've witnessed the drug supply become increasingly toxic and unpredictable. The consequences for our communities and the people of Ontario have been devastating. We have lost 7 Ontarians to opioid poisoning each day in 2024. That's 2,244 preventable deaths just last year. And each loss shatters a family, a community, friends, co-workers, peers, and care providers. And the province still has no strategy in place to tackle this crisis. Individuals and families continue to struggle to access substance use treatment when they need it. We've seen a lack of investment in quality community-based treatment. We've seen escalating wait times for detox and residential treatment programs, and huge discrepancies in care options available, particularly in northern and remote regions of Ontario. We know that there are countless Ontarians who have died while on waitlists or have been turned away when they reached out for help. And at the same time, we've seen an increasing strain on our emergency responders and hospitals at a time when our health resources are already scarce. And what did the Ford government do in response? They unilaterally made the decision to close life-saving services across our province. The consequences in our communities have been devastating. Since the closure of consumption and treatment sites across Ontario on March 31st, our communities have deeply felt the absence of services, and we can't ignore what we're hearing. The Toronto Drop-In Network reported a 288% increase in overdoses being responded to by drop-in staff and bystanders this June compared to last year. And in Hamilton, the medical officer of health raised the alarm about the escalating number of paramedic calls for opioid poisoning since April, including a record-breaking number of ambulance calls in July. That's 134 ambulance calls for overdose in just 1 month, compared to 39 total ambulance calls in March when the supervised consumption site was open. Outreach workers in Guelph report having to clean up 3 times as many discarded drug use supplies in the community compared to just a few months ago. And in Ottawa, neighbours have reported an increase in public drug use since the closure of the supervised consumption site at Somerset West. And what's worse is that Premier Ford and Minister Jones knew this would be a consequence of their reckless decision, and they chose to do it anyway. Despite what Minister Jones says publicly, the Auditor General reported that internal documents showed that the government knew that taking these services away would increase the risk of harm to communities, and they ignored the evidence. As a recent investigation showed, Minister Jones even inflated crime statistics around one supervised consumption site in Ottawa to manufacture justification for its closure. Countless public health experts, researchers, harm reduction advocates, healthcare providers, frontline workers, peers, and community leaders warned us what would happen if these essential services closed. And now none of us should claim to be surprised by the impact of the Ford government's reckless decision. With the stroke of a pen, the Ford government made policy changes overnight that are costing people their lives. And these are more than just statistics. These are people's loved ones. And the Ford government can no longer look away from what's happening. All decisions about public health need to be made with evidence and with empathy. The Ford government took away life-saving care without replacing it. Their decisions made our communities more unsafe, and their lack of a strategy is putting more people at risk. When the closures were announced, the Ford government announced that heart hubs would take their place. But months after the closures, substance use treatment is more difficult to access than ever. Heart hubs have not been given adequate funding or provincial direction to hit the ground running, and as a result, we've seen a net loss of services in our communities. The majority of heart hubs don't have their doors open, and the ones that do are only resourced to offer minimal programming. We've also seen communities start to lose hope, feeling abandoned by policymakers in this province who are unaffected by the crisis occurring on the ground. And in December, the Auditor General identified that Ontario does not have a strategy to address the complexity and scale of the crisis that we're in. They also identified a lack of leadership and accountability as barriers to Ontario combating this crisis. So we are here today to demand more. We have been in the midst of a public health emergency for 9 years, but the Ford government isn't able to face it. So today we are calling for the immediate formation of an emergency task force to address Ontario's overdose crisis with a mandate to develop and implement an evidence-based strategy to combat the overdose crisis. We need to use every tool at our disposal, including harm reduction and treatment, to save lives. The task force would create a leadership and accountability structure that we desperately need, with a clear mandate to reduce the harms of the toxic drug crisis in our communities. Overdose deaths are preventable, but we need to act. In doing so, our communities will be safer for all of us. I am asking Premier Ford and Minister Jones to answer the call of Ontario families, healthcare workers, harm reduction workers, and so many others. Value the lives of people who use drugs. Value the families who are losing loved ones. And value their lives enough to act now. Thank you, and I welcome my colleague, Alexa Gilmour, MPP Gilmour.
Good morning. My name is Alexa Gilmour, and I am the MPP for Parkdale High Park. But before I was elected, I served a local church that delivered meals to encampments and safe consumption sites. We partnered with Pasan to distribute harm reduction supplies. This work is not abstract for me. I have lost friends, 2 family members to addiction and to the homeless crisis. And now, as an MPP, I carry them with me every single day. Parkdale, where I serve as MPP, is a community with a long history of welcoming people, newcomers, people seeking affordable housing, those living with addictions. The neighbors there have built a strong network of mutual aid. Settlement services, co-ops, supportive housing, recreation centers, harm reduction programs that uphold the dignity and the safety of everyone who calls our community home. But over the past few years, the weight of the overdose crisis has grown unbearable. Resources that were already stretched thin, and then this spring, the Ford government shut down 4 supervised consumption sites across Toronto, and the results have been devastating and entirely predictable. Overdoses are up nearly 300% at the drop-in centers. Local churches have reported up to 6 overdoses a week on their steps. Custodians, librarians, neighbors are suddenly thrust into the role of first responders. It's only when we stop seeing people as fully human that we allow for this level of suffering to continue. In Parkdale, our safe consumption site is like an overwhelmed lifeboat. From April to July, visits rose by more than 500 compared to last year, with nearly 200 first-time visitors. Overdoses in the surrounding community have more than doubled, and just a few weeks ago, somebody died. And I understand that residents, desperate for solutions, are frustrated. But we have to be clear. The harm reduction organizations are not to blame. They are holding the line. They are responding with compassion and courage to a crisis created by this government's failure to provide housing, treatment, adequate harm reduction supports, and the choices that they make have mattered. Choices to shut down life-saving services. Choices to pass Bills 3, 6, and 10, which recriminalize homelessness and addiction, driving our people further into the shadows. Here is what the evidence tells us. Compassion works. Heart hubs may help some people, but they are only one piece of the solution. They cannot replace the comprehensive network of supervised consumption sites, harm reduction programs, supportive housing that the communities like mine are desperate for. This crisis will end when we remember the humanity of every person that we've lost and every neighbor that we are trying to save, because every life is worth saving. Thank you. I'd like to invite my colleague, MPP Wong-Tam.
Thank you. Thank you very much. My name is Kristyn Wong-Tam. I'm the member of Provincial Parliament for Toronto Centre. What we've seen is, since the closure of the supervised consumption sites, many of my community members are telling me, and I have personally witnessed this, is that community safety has gotten worse and not better. Mr. Ford promised to close some of those sites within 200 meters of schools and daycares, but the only thing that his closures have done is to move vulnerable people who use drugs outside in front of schools and daycares. Mr. Ford said the sites were making children and families unsafe, but all his closures did was to force people with addictions outside of their homes with nowhere to go and now using drugs in public and broad daylight. Since Ford's closures, EMS calls across the riding of Toronto Centre and right across the City of Toronto have increased because more people are overdosing. I know that my constituents want a police officer when they are feeling threatened. I know that my constituents want an ambulance to get to them as quickly as possible if they or a loved one is experiencing a heart attack. And now they have to compete with the extra demands that our first responders, our emergency responders, have to, because people who were medically supervised and had their overdoses reversed or prevented are now in life-threatening crises. Mr. Ford falsely pitted overdose prevention sites and heart hubs as an either-or situation. And I need to be very clear here. He has delivered neither. Heart hubs will have some new supports, but those supports should have always been wrapped around consumption sites in the first place. That's what experts told him. That's the advice he ignored. Mr. Ford lied when he promised Ontarians that his plan would get people off of drugs, bluntly put. Mr. Ford is driving my community to look out more than ever for those overdoses. Mr. Ford is forcing everyone in our community to constantly worry about those around them and forcing more and more people to carry naloxone. Mr. Ford is forcing everyone in my community to be on the watch out and the lookout for overdosers. They've now become first responders. My community is at a breakpoint. Fair-minded people are fed up with Mr. Ford's ongoing failure. We need an emergency response table that will tackle the double twin crises of homelessness and overdoses. It's been 8 years now since Mr. Ford has been elected and in power, and we need him to step up more than ever before. Ontario is less safe than before, less healthy than before, and less prosperous than before. We needed that leadership from Mr. Ford 8 years ago, but we'll settle for it now. Thank you very much. I'd like to invite to the podium Diana Chan-Mcnally.
So I was a supervised consumption site worker before we even had supervised consumption sites. In 2016, I was a frontline worker in a drop-in center in downtown Toronto, and reversing overdoses was a central part of my work. But it was not my dedicated role. And while I fed people and supported them with housing and healthcare, I would find someone overdosing 2, sometimes 3 times a week while making my rounds. I often found people too late to prevent serious injury to their organs, including to their brains, through oxygen deprivation. The worst moment of my life was having to perform CPR on Kyle, a gentle and wonderful man. I was unprepared for how it would feel to break his rib cage. And I can still feel how it felt to push directly down on his organs through the floating bones of his chest. But he lived, and I am so, so grateful that he lived. Do you know why supervised consumption sites began? They began because people who used drugs and workers like me could not take finding any more bodies. And by 2018, multiple sites were operating in Toronto, and overdoses had actually become rare at my work. But I remember what it was like to be on the front lines of the toxic drug crisis without supervised consumption sites. I thought that time was over, but years later, we are backtracking with chaotic and deadly results. Right now, people are dying. They are sustaining critical injuries needlessly. Without supervised consumption sites, people like me, workers in drop-ins, in libraries, in churches, on transit, and in parks, we are finding bodies in our workplaces. We are saving lives off the side of our desks. Communities are also finding people overdosing, and in fact, I've responded to 2 overdoses in my own neighborhood by my house since April. People who use drugs are deserving of the right to life, the right not to die because of an unsafe, toxic drug supply. Communities should not be finding their neighbors and their loved ones dead or overdosing on the streets. And all of what is happening now is entirely preventable, but only if the Ford government takes responsibility for the chaos that they have caused. Supervised consumption sites, they save lives. The evidence on this is crystal clear, and I have seen the alternative. We cannot go back to that place. The Ford government must restore and expand supervised consumption sites now. Thank you.
And I'd now like to welcome Hannah Robinson, a parent who's been affected by the overdose crisis.
My son died 2 years ago from an opioid overdose. He was sweet and stubborn, fiercely independent, and stunningly naive. He had the cutest freckles and the biggest plans, and by the time he turned 14, we had already started losing him. At 17 years, 1 month, and 7 days old, he was gone. And he didn't go without a fight. First, it was his fight just to stay alive in a world that he didn't understand, and he turned to substances to cope. After a while, he let me in, and then we fought together. We saw our family doctor, counselors, psychiatrists. We talked, we prayed, and we fought. We were overwhelmed, confused, and helpless. But 6 months before he died, he agreed to go to the hospital one more time. We finally found a doctor who heard him, who saw him, and even though they didn't know what to do either, they admitted him and started to help us figure it out. And it was here he told me that he felt something he hadn't felt in a really long time, and that was hope. And it was powerful. Hope isn't just a nice feeling. It's vital, and we needed it to keep going in our fight. He needed it to feel like he could maybe have a future and that he could try, and there was a possibility that he could recover. Without it, he had nothing, and with it, he had a chance. During those 6 months, I saw pieces of my son that I thought were lost forever, and I'm so grateful for that time. Ultimately, he relapsed and we lost him. But we learned from his fight, and what we learned has stayed with me. I have 7 children, and they all lived at home during this time, and I had to figure out how to fight for my son while also trying to make sure that the others were safe and protected. It felt impossible, and every solution was deeply uncomfortable. I was challenged every single day to examine what I believed, what and who I valued, and who I wanted to be. I believed that I had a responsibility to each of my children, including my son who used drugs. I valued each of my children, even the one who was hurting himself, us, and others. And I wanted to be someone who turned over every stone, who didn't give up, and who fought hard. And now I'm asking for the government to do the same. My David was his name, and he mattered. He mattered when he was in utero, and I received excellent prenatal care. He mattered when he hurt his collarbone and his Thank you. His collarbone and his ankle. He mattered when he hurt he burned his hand when he was a child, and we went to the hospital for care and treatment. David mattered when his mental health suffered as a young adolescent, and he mattered when we navigated his ADHD diagnosis. David didn't stop mattering when he started using drugs and when that turned into a substance use disorder. Closing services without an adequate, compassionate replacement is a death sentence. It takes away the one thing that the people who are fighting for their lives need, and that is hope. I need you to remember that David still matters. We can still fight for him and all the other Davids, the sons, brothers, grandchildren, parents, aunts, uncles, and friends who need services, access to care, and most of all, hope.
Thank you, and we are now open to questions.
This question is for the MPPs to start. I see you're asking for a task force, but are you also asking, as Diana said, for the return of the safe consumption sites and their expansion?
So we, as an NDP caucus, have always believed that supervised consumption sites are part of the essential continuum of care that need to be offered to people who use drugs as part of this response to the overdose crisis. We need harm reduction interventions and we need treatment programs, and it never needed to be an either or.
So are you asking for the return of those safe consumption sites and their expansion?
So at the time that this legislation passed, there were many sites that had actually applied to become sites that never got their applications even looked at. And then there were sites that were closed, and now there are still sites who have requested for an expansion of services that are being denied. What we're saying is that we need to actually have a strategy that looks at what the scope of the crisis is, what communities are affected, and allows communities to decide where they need services and what type of services, and supervised consumption sites absolutely need to be part of that. Where they end up being placed needs to be a community-driven decision based on need and based on population risk.
And I would like to echo that question to you, Diana, specifically. How do you feel about the response from the NDP in regards to the safe consumption sites specifically, remembering that it was criticism of the NDP during the last election campaign that they didn't campaign in favor of the return of the safe consumption sites?
I think asking for a strategy is asking communities what it is that they need. And so as a community member, yes, I am asking for the expansion of these sites, the return of these sites, because I've seen, again, what it was like prior to their existence and what it is like now that they are beginning to close. That strategy, if we are taking into account the community, the kinds of resources and supports that we are saying that are needed, would automatically encompass, I think, the kinds of things that I am saying. So I think having that strategy now is important, because we have seen from the Ford government that we have no strategy, that they're allowing all services to not be operating heart hubs as well as supervised consumption sites alike, and that is to the detriment and death of many, many community members.
There's this report in the Toronto Star talking about that Toronto is actually seeing a drop in opioid overdose deaths. So what's the discrepancy between that versus what you're all talking about?
Yeah, so we've always seen throughout this crisis, we've seen fluctuations in the rate of overdose death occurring over time. And right now what's happening is likely a complex sort of mix of factors between drug supply, drug use patterns, and then also a contribution of the fact that we've already lost thousands of people to this crisis. And as we lose thousands of people at risk of overdose, we're going to see the effect as that population narrows. But right now, I think the thing to be very clear about is that we might see temporary dips in numbers of overdose deaths, but we are entirely at the whim of the drug supply. So when the drug supply becomes less toxic, which is where we're at right now, we see, in the Toronto Drug Tracking Services more recently, the amount of fentanyl in an expected fentanyl sample is about 1.4%. Even just less than a year ago, last September, it was 4 times that. We are doing nothing to insulate ourselves from the changing drug supply. Next month, we could have a batch of drugs that comes into our communities that is much more potent, and people will have a lowered tolerance, and we're going to see those overdose deaths surge. We need a strategy that actually insulates people against the toxic drug supply changes so that we are trying to prevent deaths, not just waiting and seeing what fluctuations we get based on which batch of drugs is coming into our communities. And I don't know if anyone else wants to answer that one as well.
Yeah. Some might say, though, that, this happening, when we look at the deaths going down, it goes counter to what you were saying before. So what would you say to that argument?
So we're looking at very short-term trends right now. And so anyone in, Ontario drug policy research would tell you that you'd never want to make policy solely based on trends that you're seeing over short intervals, especially when you're looking at deaths. And also, I think the point that Diana highlighted is very important, that the risk of overdose is not just for those who die. There are significant risks of the non-fatal overdoses that are occurring. For example, as a physician, I can tell you that we've had to become comfortable with new diagnoses of essentially consequences of anoxic brain injury. So delayed post-hypoxic leukoencephalopathy was not a diagnosis that most neurologists had actually seen prior to the last couple of years. But what it is essentially a deterioration of the brain that occurs after someone survives an overdose, is successfully reversed. But because of the time that their brain was deprived of oxygen, they see a deterioration in their physical function and their mental function, and it can actually lead to death even weeks out from an overdose occurring. I've seen people lose the function in their legs because they essentially suffered a stroke during their overdose. And then we see, many hidden complications of what essentially is anoxic brain injuries that are unwitnessed that are happening. So we can't just look at deaths as a marker of harm. We need to look at the overall number of overdoses that are occurring because we know that increases not just mortality, but also morbidity, strain on our health system, and long-term disability. And I wouldn't put significant weight on a temporary dip in the reduction in overdose deaths because, again, we're seeing a weaker drug supply this month. We have done nothing to protect ourselves and our community members next month.
Hannah, if I could ask you a question. Thank you for coming. I imagine this is very difficult for you. So the Ford government is going forward with this, abstinence-based model. If your son were still alive, would that have worked for him, or what are your thoughts on that?
10 years ago, 5 years ago, probably would have agreed with him. It's been a learning process to understand that what you think is common sense isn't a solution to a complex problem. He needed multiple approaches in treatment, none of which were available. Some were things that we found ourselves. Some were finally finding supports in the community. He had a short period of being homeless, so he needed supports there. It's not simple. It's not as simple as just don't do drugs. But I've struggled with that question, especially trying to balance keeping my other children safe and trying to protect him and get him treatment. In fact, my husband and I, we don't use drugs of any kind, or alcohol or smoke. We don't have any substances in our home. So I really thought that would protect my son, and it did not. I think we just need to broaden our understanding and really listen to the people, both on the ground interacting with people who use drugs, but also the people who use drugs themselves. And I don't think you're going to find very many of them, or at least not in my experience, that are going to say somebody telling them to just abstain was going to prevent them from walking the road that they did.
Thank you, Hannah. That's really appreciated. I had also another question for the MPPs. How do you plan? You're asking for a task force and a strategy. How do you plan on, hopefully convince the government to go ahead with your idea and not do what we've seen them do oftentimes, which is just, well, we already have a plan and it's being enforced right now?
I can start, and then I imagine my MPP colleagues will want to join as well. But the current government doesn't actually have a strategy. That was what the Auditor General identified, was that what they were working off of was a 2016 approach, which was actually before we saw the widespread increase in fentanyl. So we have never had a strategy to deal with this crisis, which is a profound toxic drug crisis, killing people at numbers we weren't seeing in 2016. My hope would be that this government starts to listen to its own experts, starts to listen to the Auditor General, starts to listen to the Centre of Excellence, which they have put in place to try to address this crisis. To date, they have not been, but I think that's part of why we're here, is trying to raise awareness of this, to raise awareness of the gaps, and also to show people that we have opportunities to take action. And we just need our elected officials to actually respond to that call to action and do their jobs. Without doing that, it's as if we didn't have a plan to address, cardiovascular disease, or if we didn't have a plan to address housing. It's no less unacceptable when it's impacting people and communities who use drugs. And I wonder if,
I would just want to point to the times in which we have responded to crisis, including the COVID crisis. So we have the capacity to respond to a crisis like this, as my colleague has said. When we have other health issues, we respond, and when we've had urgent emergency crisis like the COVID-19 task force, we've stepped up to the plate. We can do it here, and we're insisting that the Ford government care about all of our residents, even those, and especially those who need us the most.
I definitely want to add my voice to that question. When COVID-19 hit, what we saw was the mustering of government forces from all three orders of government. They were meeting regularly at a command table that included first responders, that included health experts, and each one of them was tasked with responsibilities, and they were reporting back and being accountable to each other. So we were able to get out of a global health pandemic and a crisis relatively safely, whether it was scoring up the PPEs, making sure there's distribution and manufacturing of vaccines. That took a whole of government, from every order of government approach. I saw that happen when I was at the City of Toronto. Everybody was grasped with the crisis. 2,244 deaths took place in Ontario. And if that is not a health crisis that requires the same wartime speed to respond to what we're seeing right now, I don't know what is. The other thing is that communities, stakeholders, other healthcare professionals, healthcare workers, harm reduction advocates and workers, they're already meeting with each other. These conversations are taking place. Who's missing is the Ford government. And so although they own a big piece of this, I wouldn't say that they own all of it, because homelessness, addictions is everybody's business, but mental health addictions, health falls fairly squarely under their purview, and they're absolutely missing. So there's no opportunity for accountability. There's no ability for them to hear what the experts are saying and then to take short-term and develop long-term actions to respond to it. And I think that's the biggest shame of all, is that they're entirely missing from the table.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.